so much, Samra and Louise and Alexis, for sharing your stories. It's been very touching. I'm here to talk to you about adverse childhood experiences today, also called ACEs. As the host said, I am the Research and Evaluation Manager here at CUPS. And let's begin. So what are ACEs? ACEs are experiences in abuse, neglect, and household dysfunction that happen to within households that cause trauma and stress and that occur in individuals who are 18 and under. So back in 1997, there was a study completed by the Center for Disease Control as well as Caso Permanente, and they found that the 17,000 participants who participated in the survey, that there were, for experiences of abuse, neglect, and household dysfunction, there were impacts to health that include behaviors such as cancer, heart disease, substance abuse, suicide attempts, and many others as well. So what this study found out was that this relationship is actually quite common, and that actually a lot of people have these ACEs. So for the number of ACEs that you have, they made a 10-question questionnaire that answers yes or no, and then for each question they ask along the lines of abuse, neglect, and household dysfunction. For each question that you answer a yes, those yeses get added up, and that creates your ACEs score. So an individual can have an ACE score of 0 to 10. So what the research now says about why these relationships are there between childhood adversities and later on health and social outcomes is because the toxic stress created from trauma that you've had in your past actually changes your stress response system within the body and can actually create wear and tear on the brain systems of developing children as well as other biological systems as well. So since this landmark study in 1997, there has been other ACEs studies as well, and Alberta is no different. So back in 2013, Alberta did an ACEs survey on Albertans of around 1,200 done through the phone, and what they found in the study was very consistent with other studies as well. So that is that ACEs are actually very common in what we call the normal population, and then also that ACEs are highly interrelated. So the ACEs don't actually, they rarely occur in isolation. But this study showed that at least half of those surveyed, so over 600 Albertans of the 1,200, actually experienced one or more ACE in their life. So when we look at data from this Alberta ACE, and then data from some of the surveys that we've done at CUPS around ACEs, the results look quite different. So the pie graph on the left shows that 88% of those surveyed in the Alberta had 3 or less ACEs, and 12% had 4 or more ACEs. And then at CUPS, about a year ago, we started a pilot ACE survey, and we asked some of our participants to go through that ACE questionnaire. For this particular pilot, we had 27 participants, which is a bit of a smaller sample size, but what we found out there was that close to 60% of those surveyed had 4 or more ACEs, which is quite a drastic difference than the 12% in the Alberta ACEs survey as well. And then 41% had 3 or less ACEs. So currently at CUPS, what we're doing is we have the counselors who administer the ACE survey with their patients, and then our social workers who do home visits with our families we're in the process of trying to implement the ACE questionnaire within their practice as well. So there's many reasons why we collect the ACE survey for our participants, and we see them as being beneficial on many levels. So the first one would be on the client and frontline worker level. We see it as both an intervention and educational tool. So intervention in a way that it helps the workers be able to work through the trauma with their clients, and then also build that trusting relationship between the worker and the client. Educational in a way that this knowledge about the ACEs can be very empowering for some of our clients to help potentially explain some present-day functioning, also be able to mitigate some of these risks with their own children, and really help reframe the question from what's wrong with me to what's happened to me, and that's really powerful as well. On the organizational level, the ACEs survey is helping us to inform the trajectory of services for some of our clients, as well as help us to have a better understanding of of why certain groups might do better in some interventions versus others. And then on a community level, this ACE survey provides us with information around common language and then just a baseline understanding of what trauma is. And then on a policy level, the ACE survey has helped us to be able to educate policy and decision makers, to educate them on what ACEs are, and basically that it's a public health issue that's costing the system millions of dollars, and then from there be able to create some policies to mitigate the impact of ACEs. So it's important to understand that although ACEs help us to understand our participants better who walk through our doors, the ACEs are not deterministic, nor are they a concept that is standalone. So I really like this visual here because it places ACEs in the context of other things as well, such as trauma, brain science, and resilience. And when I'm talking about brain science here, it's about what we now know about early brain development when you're a kid, and how that brain development is a huge factor in how a child develops, and therefore their later on health and wellness. If you want to learn more about brain science, I would highly encourage you to visit Alberta Family Wellness Initiative. They have tons of videos and resources to learn more about this brain science concept. And then I also really like this visual as well. Again, it's the same concepts, but shown differently on a continuum. From one end, it's deficits, and on the other end, it's assets. What my favorite thing about this is that under the words, the words underneath the concept actually make a sentence. So what happened to you affects your whole life, but you can learn new skills to get what you need to thrive. And I think that's a very powerful way of thinking about it and placing into context what ACEs actually mean. So all the concepts that we just talked about has had a huge role in CUPS's organizational-wide theory of change, as well as our strategic plan, now in our second year. So you read it from the bottom up. So for adults and families in Calgary living with the adversity of poverty and traumatic events, who are in crisis, vulnerable, and stable, we offer in close collaboration with partners an integrated set of services listed in those boxes in order to build economic, social-emotional health and developmental resilience, to achieve self-sufficiency, to ensure that Calgarians overcome adversity, reach their potential, and end the cycle of poverty and trauma for themselves and their families. On the right of that are the list of our values that we as an organization follow, and then underneath that, we talk about how our work is rooted in the science of building brains and resiliency, is reliant on provincial policies and systems, and that in order to ensure success, we advocate to reduce barriers, apply the research, and contribute to the research as well. I want to note that the activities on the right, such as research and advocacy, help to improve our programs on the ground in order for us to better understand if they're actually working, and include that evidence-based practice into our programming. And then in turn, the programs on the ground help to inform what type of research and advocacy projects we should be focusing on as an organization and beyond. So when we go back to thinking about ACEs and what we as service providing organizations can do, at CUPS we see it as preventing the trauma from occurring in the first place. So what this means for CUPS is that our programs focus on the families, so both parents as well as the children. And so we work with the whole family, and we are able to prevent toxic stress from happening in the first place, and then also work with the parents to educate them on exactly how important brain development is for their children, as well as build those nurturing relationships between parent and child. And then so those programs are listed under the blue and the purple columns. And then for those individuals who can't prevent ACEs from occurring because they're adults now, we offer services in health, physical and mental and substance abuse support, as well as provide opportunities for community engagement to access further schooling, as well as food access to build that resilience within them and buffer some of those impacts of ACEs. So from the CUPS theory of change, we've also designed a CUPS resiliency matrix, and this speaks to, it helps to measure how well participants are doing on the resilience domains of economic, social, emotional health, and developmental, along with the subdomains. So the resilience spectrum goes from in crisis, vulnerable, stable, self-sufficient to thriving. And so when a person comes in to see CUPS, they are met with an intake worker, and the intake worker and the client sit down together and help, and together they map out where they are on the matrix. And then from there, once they are able to access some of our programming, a few months later, we do a a post-test or a follow-up, and then we are able to then see if they have been able to progress or retreat or along this resilience scale as well. So to date, we've completed over 1,200 pre-resiliency matrices, and then we're currently doing the follow-up as well, so the green dots. And from there, we've also ran some statistical analysis around how well this tool is doing. We found that in terms of reliability, the questions actually asked in the subdomains actually measured resilience in a vulnerable population. So that's a huge win for us. And then moving forward, we're working on figuring out more of the reliability and then the validity. So we can move forward with this tool and know that it's actually working and measuring our clients in a way that helps us be able to see how they're doing on their road to resilience.